Hello and welcome to the session. I am Dr. Raghavendra S. Segade, presently working as a lecturer in Department of Pharmacy Practice in HSK College of Pharmacy, Bagalkot. Now, in this online session, let us understand the introduction part of community pharmacy practice. The learning objectives of this session would be, upon completion of this lecture session, you should become thorough and you should be able to define and describe about what is community pharmacy practice and what is pharmacy practice, development of pharmacy practice, roles and responsibilities of community pharmacist, status of community pharmacy in India, role of government in improving status of community pharmacy, and lastly, we'll be seeing Pharma Vision. Now, let us move to the introduction part of pharmacy. The word pharmacy is derived from Greek word pharmakon, which means drug or medicine. Pharmacy has been defined as the profession which is concerned with the science of identification, selection, preparation, preservation, and standardization of suitable drug substances and formulations thereof, and distributing and or dispensing these after confirming its rationality and rightness of therapy for improving the well-being of the people. The vowel, which is universally recognized as a symbol for pharmacy profession. So, the pharmacy profession is a vast, quite exhaustive profession which starts with science of identification, selection, preparation, preservation, standardization, distribution, dispensing, conforming its rationality and rightness of therapy, and for improving well-being of the people or the public. The definition of pharmacy and the activities of the pharmacist is quite exhaustive. Now, in this slide, we'll be understanding the pharmacy practice and the apothecaries. In earlier days, physicians had to perform both the duties of diagnosis and compounding of medications. During the second half of the European Middle Ages, the pharmacist became separated under the name called apothecaries. So, a separate system has been started with the name of apothecaries, where the pharmacist is in charge in dispensing and compounding of medications under the name called apothecaries. Now, let us understand the definition of pharmacy practice. Pharmacy practice is an art of science and science of performing of different patient care activities, especially related to the prevention, correction, and avoidance of drug and therapy related problems involved in the prevention and or treatment of illness, with the dispensing of quality medicines as their prime function. Objective of pharmacy practice. The objective of pharmacy practice mainly includes with ensuring rationality in drug use and promoting health in that turn, well-being of the person on the basis of scientific knowledge and skills where the pharmacy practitioners possesses. Now, in this slide, we will be understanding the functions of pharmacy practitioner. Before that, who is called to be as pharmacy practitioner? An individual who performs practice of pharmacy according to the rules and regulations framed by the government, and he maintains the professional ethics, is called to be as pharmacy practitioner. The pharmacy practitioner involves in the following functions: interpretation and evaluation of prescriptions, drug orders on the basis of legality, clinical principles, and pharmacoeconomics, selection of drug regimen or device, and participation in drug-related problems and drug-related research, counseling the patients for storage handling and administration of drugs, as well as providing unbiased drug information to the patient, paramedical and medical professionals as and when required. Compounding, dispensing and labeling of drug products and maintenance of necessary records. Advising on non-pharmacological aspects of health promotion and well-being. These are the various functions of pharmacy practitioners. Now, let us understand how the pharmacy practice is classified. The classification of pharmacy practice goes in this manner. Pharmacy practice can be classified into various systems. When the pharmacy practice, when it is applied to the community settings, it is said to be as community pharmacy. Community pharmacy are the legally established premises where registered pharmacists involved in dispensing of medicines. Registered pharmacists are those whose name has been registered in particular state councils and they should be qualified as a pharmacist. To qualify as a registered pharmacist, the minimum education in India is D.Pharm, which is Diploma in Pharmacy. And after qualification of diploma, he has to undergo 500 hours of training. Then his name has to be registered with all the validity of all the qualifications of all the proofs has to be submitted to the state pharmacy councils, and his name will be registered in particular registered councils. Then he will become registered pharmacist. So registered pharmacist involved in dispensing of medications. And the main aim of community pharmacist is to promote health, whether it may be individual health and the public health. When the pharmacy practice, when it is applied to the hospital settings, that is said to be as hospital pharmacy practice. Hospital pharmacy is a profession where a registered pharmacist is involved in hospital pharmacy services, ensuring distribution of safe, efficacious and cost-effective medicines to both inpatients as well as outpatients. He utilizes opportunity to promote rational drug use, and he stick to the principles of sometimes the policy-making committees concerned with selection of drugs, controlling of infections, promoting use of essential drug concept. He is mainly the person who is involved in compounding and preparation of sterile products in the hospital. So hospital pharmacists are more concerned with drug management aspects like development of drug formulary, drug selection, distribution, etc. Now moving on to the clinical pharmacy. Pharmacy practice, when it is applied to the clinical settings, it is said to be as clinical pharmacy practice. Clinical pharmacy practice is a specialized extension, more specialized extension of community or hospital pharmacy, where registered pharmacists play a role of pharmaceutical advisor for the treatment strategies and effectiveness of treatment regimen. They assess prescriptions on the basis of clinical aspects, carry out therapeutic drug monitoring, report adverse drug reactions, act to minimize potential drug interactions, and provide patient counseling. There has been alarming increase in the case of chronic disease in India. Many of these coexist and need multiple drug interventions by clinical pharmacists as a part of pharmaceutical care. Clinical pharmacy practice often collaborates with physicians and other healthcare providers. Many pharmacists gain more education and training during post-PharmD. They undergo the residency programs in a specialized area and are often referred as super specialty clinical pharmacist. That will be studying in coming slide. So he works like a pharmaceutical advisor for treatment strategies and designing the effectiveness of treatment regimen. Classification of pharmacy practice, when it is applied to the drug information, it is said to be as drug information pharmacist, where the pharmacist can provide unbiased information and By providing unbiased information, he can reduce the complications in the medications. So he can promote the rational use of drugs. And he can increase the patient adherence, that is patient compliance, by properly educating the patients. And unnecessary loading of the drugs to the patients is avoided many times, whether it may be drug interactions and interactions notified by the pharmacist, and contraindications or adverse drug effects or any problems related to the drugs will be told or will be brought into the notice to the doctors. So thereby he is promoting, educating the patients. He is by poison or drug information centers which works around the clock, he is providing the valuable information to the medical persons as well as paramedical professionals, and he is providing the patient care. And he tells about the proper use of drug delivery systems or devices. Now, there are many specialities after PharmD. Now let us understand the different specialities post PharmD. Adult medicine, ambulatory care pharmacist, cardiology pharmacist, clinical administration pharmacist, clinical informatics, critical care pharmacist, drug information pharmacist as I told you, emergency pharmacist, endocrinology diabetes pharmacist, geriatrics, hematology oncology, immunology transplantation, infectious disease, managed care, medication therapy management, nephrology, nutrition support, outcomes and economics, pain and palliative care, pediatrics, pharmaceutical industry. The pharmacist after PharmD can work in pharmaceutical industry as a pharmacovigilance team manager, or he can work in clinical research industries. Poison control, psychiatry and central nervous system, research area, which includes even teaching, and lastly, the women health. So the pharmacist can work in different regions. We can see here almost many areas, more than 20 specialties. He can work in different regions after PharmD. This I have taken from American College of Clinical Pharmacy. Now we have to understand the concept of 8-star pharmacist. The WHO, in the report of its consultative group on preparing future pharmacists in 1977, identified 7-star pharmacist concept. And the FIP, Federation of International Pharmacists, has added one more function, and from 7-star they made it into 8-star. Earlier, WHO has identified the pharmacy profession into 7-star concept, pharmacist concept. FIP, that is Federation of International Pharmacists Association, has added one more star, making it into 8-star pharmacist. That explains endless activities of pharmacist, which are as follows. Now we will see the 8-star pharmacist concept. The pharmacist can act as caregiver to provide caring services to an individual and the population. The pharmacist is a good communicator to establish proper linkage between the physician and the patient, closer support for prescribers, medicines and management. So he should become a good communicator. Pharmacist can become manager to manage health resources and information effectively. Pharmacist can work as decision maker for appropriate, efficacious and cost-effective use of health resources. Pharmacist can work as leader, is a leader to lead the multidisciplinary team including other healthcare providers. Pharmacist is a lifelong learner. Pharmacist has to continuously learn, undergoing continuous education and keep himself updated with up-to-date recent advancements in the technology in healthcare team to perform his task, and he should involved in research and developments taking place in the pharmacy practice. The pharmacist is a teacher to educate next generation pharmacists training for other professions. And pharmacist is a researcher. He conducts research in different walks of life, whether it may be the education institutions, whether it may be the pharmaceutical sectors, or whether it may be the community related sectors. So he's a researcher. This is the 8-star concept of the pharmacist, which has been given by the FIP followed by WHO. Now let us understand the role and responsibilities of community pharmacist. The community pharmacist role is never-ending role. The first role, if I want to tell, it is establishment of professional pharmacy. Dispensing of medicines from community pharmacy outlet is a primary activity of professional pharmacists. Obviously, design and establishment of professional pharmacy outlet is the first responsibility, because we are learning about establishment of professional pharmacy. Because the pharmacy reflects image of the profession in the society. Its setup, its interior, exterior decoration should be made to follow the concept of the patient care. According to the international trends and professional activities, the retail pharmacy should be named as pharmacy. Medical stores or many other such names has built unprofessional image of the pharmacist. So the right establishment of retail pharmacy is influenced by attitude of the pharmacist. A storekeeper attitude is sufficient to run medical store, but pharmacist professional role can only develop community pharmacists. So he should have all these things, all these qualities, the interior as well as the exterior decoration, the window displaying of the community pharmacy. He should have the good professional image in the society. To develop all the professional image in the society, a proper establishment is required, which creates the professional aspect of patient care. Now, the responsibility of the community pharmacist in dispensing of medications. Dispensing of prescriptions is highly professional and it involves many things. It's not just mere act of reading the list of items and selling this like other household items. Pharmacists should thoroughly evaluate the prescription. The instructions related to the use and storage of drugs helps the patient to adhere to the medication and in turn get maximum benefit from their medicines. Procurement of quality medicines from the licensed wholesaler, which is one of the important quality of the good pharmacist, which is mentioned in good pharmacy practice. Storing stock in a desired controlled environmental conditions, use of modern approaches for removal of products from shelves, billing and packing are the various activities where pharmacist has to perform in day-to-day routine work of community pharmacist. Chief pharmacist with the help of technical staff can provide dispensing services in the effective manner. See, any pharmacist when he is doing duty, he has to dispense the drug. Dispensing is not an act of just trade. He has to dispense the drug with utmost caution. He should evaluate the prescriptions regarding about various adverse effects, drug-drug interactions, or the storage conditions has to be met into account. He should purchase the pharmaceutical products from good vendor, from good wholesaler. Qualitative medicines is the utmost thing. When you compromise with the medicine quality or medication quality, then how can I expect the good benefit from the patient in the patient? So dispensing of medication, no doubt, is a good act, is a great act from the pharmacist, but the proper procurement of the medications from the licensed wholesaler, properly storing the medications as per the guidelines, and billing and packing are all the different activities where he has to take care. The pharmacist is actively engaged as a family pharmacist. Now you may be amazed to hear family pharmacist. We have heard about the family physician, but family pharmacist is a new concept to the Indians. The family pharmacist is a practice where the patient and his family members take all their medicines from the same outlet. So the family pharmacist is a thing where the patient and his family members, they come to the pharmacy, they take from the same outlet. It will not only be beneficial to maintain consistency in the business, but will also benefit the patient. The concept of family physician is not new to us, whereas the concept of family pharmacist is definitely new. So the pharmacist should work as a family pharmacist. He has to maintain the patient medication record of an individual patient, which is the primary step of serving as a family pharmacist. This is beneficial in avoiding all the drug therapy problems, whether it may be drug-drug interactions or whether the patient is taking polypharmacy, more than one drug, he may come across different drug-drug interactions. So he has to maintain the patient medication record. Again, after maintaining the patient medication record, he can reveal all the patient history, whether it may be the lifestyle factors of the patient, allergic reactions of the patient, any other drug-related problems in the patient which has been notified in the earlier time. So proper maintenance of records, that is patient medication record, is very much essential, and this tool can make the pharmacist to ensure suitability of medicines for the patient. He can choose right medication for the right patient. Pharmacist, he is involved in patient counseling, whether it may be related to the disease, patient counseling related to the drugs, patient counseling related to any other important aspect of educating the patient regarding about lifestyle factors. So the pharmacist, what he is doing here, he can provide unbiased information regarding about drug or disease, which will be written in the local language, and he can provide pills to the patient, that is patient information leaflets, which will be written possibly in the local language. So pharmacist is providing unbiased patient information through patient information leaflets. He can use pictograms for illiterate patients. So he can provide education to the illiterate patients by providing pictograms, by use of pictograms which are nothing but pictorial representation of the image, where the illiterate can easily understand and take the message, and he can adhere to the drug therapy, and he can avoid unnecessary problems which are associated with the medications. And when he is becoming medication adherent, he can avoid all the unnecessary problems, whether it may be when the hypertension patient is not taking the antihypertensive medications, there may be a possibility of stroke, ending up with stroke. So all the things and all the dangerous consequences can be avoided by proper following the guidelines of the therapies, by adhering to the medication. No doubt the pharmacist is a person who can treat common ailments. As and when required, the pharmacist is a person who is the first point of contact for the patients. He can provide unbiased information regarding about the treating common ailments, which may be common cold, headaches, or sometimes loose motions, or the contraceptions. Family planning, which method has to be used or adopted by the patients. He can educate the patients about not to self-medication, and he should take the responsibility of the outcome of the therapy. So the pharmacist is the first point of contact where he can treat the common ailments, treating common and minor ailments. Clinical services. In developed countries, about 30% of the hospital admissions are due to drug-drug interactions, or I should say drug-induced reactions. In India, we don't have such data, but definitely the percentage would be much more higher. To overcome all these things, the retail pharmacist can play a great role in improving the patient's medication adherence, identifying the possibility of drug therapy problems, whether it may be the drug interactions, monitoring and reporting the adverse drug reactions to the concerned authorities. And he can bring the facts and figures for reducing the drug-induced reactions, and he can reduce the hospital admissions. So he can provide valuable clinical services to the patients. The pharmacist can provide health screening services. Screening services include estimation of blood glucose level, blood pressure monitoring, cholesterol screening, calculating body mass index. He can do all these things on a routine basis. A qualified and trained pharmacist should have liaison with the medical practitioners in providing health screening services to the patients. Attempts to provide health screening services will enhance the image of the pharmacist as well as healthcare profession. He can develop a good image in the society by providing health screening services. Pharmacists should extend their services to geriatrics and bedridden patients. These are said to be as home care services. Here, pharmacists should supply medicines, give advice, and develop dosage regimen to improve the quality of life and outcomes of the treatment. Such services are also beneficial for the patients who are just discharged from the hospital. So these services are termed to be as home care services. The services are provided directly to the home. Pharmacists have necessary knowledge of quality and cost of the medicines. At a strategic level, he can appraise the evidence and help the physician in proper selection of proper brand of the drug. The lack of curiosity for scientific knowledge, failure to update the advancement in the drug therapy, and large number of formulations. See, in India, we have more than 1 lakh formulations available in the Indian market. Maybe as a single drug or fixed drug combinations are the main reasons for irrational prescriptions. The pharmacist, with their professional relationship with the prescriber, can promote a rational drug use concept. He is also responsible to be updated about the banned drugs and the formulations and other medications of not practicing and discourage its practicing of dispensing in case of banned drugs. Nearly 70% of the population of India is deprived of essential drugs for their treatment. Pharmacist here can provide valuable information regarding about the use of drugs, and he can bring the national use of drugs, that is, he can prepare essential drug list, EDL. Drug information services. The medical practitioners do not generally have enough time to access unbiased information and rely heavily upon the pharmaceutical industry for drug-related information. The pharmacist should share information regarding about the standard therapeutic procedures, quality and cost and effectiveness of the drug therapy. What are the alternative treatments available and how to overcome adverse drug reactions. He can provide all this information with evidence-based information where you can get from online. Many softwares are available like Micromedex, Lexicoms and other information up to date where you can retry the information and you can give that same information to the physicians or other healthcare providers. Thereby, he is assisting he is giving the evidence-based information to promote healthcare. There he can work in drug information centers or poison information centers and he can provide valuable information to the required person. Continuing education. Continuing professional education programs will improve the knowledge and train the pharmacist about the pharmaceutical care concepts. Since a single pharmacist cannot sail and counsel the patients in a busy pharmacy, all the staff should be adequately trained. Various community pharmacy associations and institutions should organize on seminars on various pharmacotherapeutic areas and drug-related issues to ensure rational use of medicines. In community pharmacists should organize all such training programs for proper healthcare providers and consumers. So he should be updated, he should keep on himself updating about valuable information regarding about the drug and the disease, and he should attend the seminars, he should attend the CPE educations online, and he should keep updated himself for education. So he should continuously learn, he should become a learner now. Lastly, health promotion. Pharmacists should participate in health promotion and other social activities and other national health programs. All the illnesses do not require medicines, but mere psychological support, motivation, and attitudinal changes. Pharmacists can guide patients about lifestyle changes. Pharmacists can actively participate in health promotion programs such as nutrition, tobacco cessation, how to quit alcohol, quitting alcohol, diabetes therapy, asthma therapy, AIDS prevention, family planning, mass vaccination campaign programs, encouragement of breastfeeding, etc. Now we can understand the status of community pharmacy in India and the role of the pharmacist. Government as well as common man have not recognized the role of the pharmacist as healthcare providers. They are not aware of what services the pharmacist could provide beyond the trading of medicines. In hospitals also, persons other than the pharmacist look after the purchase and inventory of drugs under the supervision of the medical officer of the hospital. The standing committee of the report of Ministry of Chemicals and Fertilizers had made pharmacists, have threatened pharmacists actually, which has been given in 2002. They have given the statement clearly there is no need of pharmacists to sell the medications. That it can be done by any educated persons. Later on, the collective efforts of different pharmaceutical professional organizations, they protested against the committee report and succeeded in resolving the issue. So the role of pharmacist, how it is the role of pharmacist is there in the community as well as in the other, how they think about pharmacy, you can understand. Pharmacist, the pharmacy profession is still under the Ministry of Chemicals and Fertilizers. It's not under the healthcare. PharmD is under the health ministry, but the pharmacy and other profession is still under the Ministry of Chemicals and Fertilizers. We can understand the role of pharmacist here. They have not built a rapport or the professional image in the society. That is the status of community pharmacy in India. Now, coming to the other aspect, that is the nomenclature of the pharmacy and pharmacist. Though the pharmacy profession in India has history of more than 80 years, it could hardly be able to create their identity, as I told you, as experts in medicine or medication experts. The pharmacy profession is industry focused. Moreover, it is focused onto the industry rather than the patient focused, due to which pharmacy professionals have gained recognition as technical professional like manufacturing chemist, production manager, academicians, etc. The retail pharmacists serving medical stores are the actual face of the pharmacy in society and also bear unique identity in the society. Like displaying other names like chemists, non-display of name and qualification of the practicing pharmacist has portrayed the image of the pharmacy. It has degraded the image of the pharmacy. Some pharmacy have seen storekeeper or drugstores. Storekeeper, you can see recently they have said new designation has come up in some states like Aushad Nirman Adhikari, drug manufacturing officer. So it symbolizes the role of the pharmacist as only drug manufacturer. Thus, still the actual identity and the role of the pharmacist remains unestablished in the community. That has to be changed by bringing the proper nomenclature of pharmacy and pharmacist. Dispensing by non-professionals. This is one of the major area of concern. Most of the pharmacists, still pharmacy, they dispense the medication, they don't have qualified pharmacist. Then when the dispensing is done by non-professionals who are not from pharmacy background, then how can I expect good service to the society? We all know that drugs are very harmful chemicals that are suggested to particular patient after thorough diagnosis by the physician, according to the principles of medical science, and then after ensuring its suitability to the patient, it is dispensed by pharmacist according to the principles of pharmaceutical science. So almost all the countries have given legal status for dispensing under direct supervision of the pharmacist. It is not only as per the DNC Act, which has taken place in 1940, but before that also pharmacists were considered as an authority for supplying medicines in India. However, negligence in implementation of law, domination of traders, trade practice, association that believe in trade, and lack of visionary leadership in retail pharmacy. These are some of the lacunae which led the unethical practice of dispensing by non-professionals. Isolation of the pharmacist. At the doorstep of the government and in the public, the pharmacy profession is always isolated. Though the pharmacist is in direct contact with the patient is not aware of the role of the pharmacist in improving his health. As a part of curriculum, the degree pharmacist it is based on industrial education and training, thus remains away from the patient. The concept of introduction of the PharmD program now, which is directly under the health ministry, and secondly, all the B.Pharm education is more focused towards industrial aspect, which I have said. If you see the apex level, pharmacy should be a part of health ministry, but it is governed by AICT as a technical course, and it is under the Ministry of Petroleum and Fertilizers, as it is a business of chemicals. But however, you can see some changes because the implementation of PharmD program in 2008, which is directly under the health ministry, and secondly, this program requires hospital exposure and practice of pharmacy in a real-time scenario. Now the pharmacist is not only dispensing the medications, he is going to the bedside, he is going wide rounds with the doctors. Slowly the pharmacy profession from industrial oriented, it is turning into the clinical oriented course with the implementation of PharmD program. Continuing education and training. The poor recognition of the role of the pharmacist in healthcare has been linked with the insufficient education and lack of professional training to the in-service pharmacists. A mere diploma in pharmacy level education is not sufficient and to give a proper education to the patient, whether it in case of drug information or providing disease information. Recently, Pharmacy Council of India proposed to make it mandatory that pharmacists should complete at least 2 refresher courses within a period of 5 years. It is also awaiting for proper uniform implementation in all states of India and its actual practice. So, proper education is required. He should be trained. Proper education is required. He should be trained enough and he should be skilled in particular area. Then only he can give good services to the society. Having said that, I would like to move further, going to the motivation. Pharmacist is the most trusted and most readily available healthcare professional. He has many opportunities to provide one-to-one healthcare, one-to-all healthcare. However, he should change his focus as trader and take all the initiatives to work as a healthcare professional. This can be achieved by making provision for training and its practical implementation. Appreciation to the community pharmacist practicing pharmaceutical care services. should be done by regulatory bodies and other professional associations. So he should become like motivator by providing motivation to the public. Social awareness. If you take the Indian scenario, most of the people live under low poverty, low literacy, poor communication between the prescriber and the patient. Patients' fear of asking questions are some of the public related problems. In India, 70% of the population lives in the rural area and 80% of doctors practice in urban areas. This is another main reason for poor health care. First of all, I would like to tell you the crunch of doctors here. Doctor-patient relationship is very, very low. Almost if you take the count of 1000, there are not more than 6 doctors available. So in this scenario, the training has to be given to the pharmacist. The training to the pharmacist alone is not sufficient for effective pharmaceutical care practice. For better benefits of pharmaceutical care, the common man should be made aware of services which can be rendered by the pharmacist. In addition to counseling, pharmacists should take every opportunity to educate the patient. That is the meaning of creating social awareness. He should encourage the patient to ask questions and to speak out when unusual conditions happen. The implementation of the concept of family pharmacist, as I told you, will be ideal in such situations. A pharmacist association and participation in various national health programs can spread awareness about its existence and role in the society or in the community. Product-focused practice. The pharmacy is the only health profession that is estimated by its sale of the product rather than its pharmaceutical care services to the society, isn't it? Therefore, attempts should be made to recognize pharmacist for his practice as a healthcare provider. It should not become like only focused to the product. It should become to the focus to the patient care. Regulatory control. Legally speaking, pharmacists dispense medicines on the prescription of medical practitioner. Since the prescription contain brand names, so pharmacists hardly get a chance to select medicines. So here, the pharmacist is not a legal authority to make a selection of medications, because the physicians will be writing in the brand names. He don't have any legal authority to substitute the drug. Whereas in abroad scenario, if I want to compare this one, the physicians will write medications in the chemical name, and it becomes the pharmacist right to select or substitute brand on the basis of the quality should be given to the pharmacist. So the quality of the patient's condition, affordability, many issues will be brought to the notice of the pharmacist. He becomes like a decision-making authority, and he take the decision which medicines have to be dispensed to the patient regarding about the need of the patient and requirement of the patient. So secondly, there is no special drug index for OTC medications, so that pharmacist can dispense them for minor ailments. To encourage the treatment of common ailments by pharmacists, regulatory authorities should draft OTC list and monitor the usage of such drugs with adequate information and warnings. So all these things has to be brought into practice. Many medical practitioners stock and dispense prescription medications to a larger extent. These medicines escape strict regulatory controls. So this all has to be controlled, and separate provisions has to be made for pharmacy that he can choose the drug. The doctors has to write only the chemical name, and he should become like a decision-making authority. After identifying the patient condition and affordability, he can choose which medication has to be dispensed to the particular patient. Unfocused organization. In democratic country like India, voice of public can change the system. It is obvious. The organized structure in a particular profession as an association is an effective way for communication with external agencies, including government. Fortunately, I should say, pharmacy professionals are also united according to their basic working type. Several organizations like APTI, Associations of Chemists and Druggists, Drug Inspectors Welfare Association, Indian Hospital Pharmacist Association, Indian Drug Manufacturers Association, etc. have been framed, no doubt about it. But unfortunately, such associations are still struggling to build image of the pharmacy and pharmacy profession in the society. Because why they are struggling? Because unfocused agenda. They don't have proper agenda. They lack proper vision, and they work on different missions. So the main goal of social recognition or as a healthcare provider or professional healthcare provider is not meeting. So these are all the different status of community pharmacy in India and how to overcome that one. These are all different lacunae which are there in India. Now, what are the suggestive actions which should be taken for improving the status of community pharmacy profession? Doctors should be restricted to hold the stock of the medicines. United States Pharmacopoeia mentions general chapters like good dispensing practices for storage and stability. It has to be brought into practice in Indian's scenario also. Professionals should be from pharmacy background. Other professions should not be encouraged to distribute and dispense the medications. Pharmacists should not be considered as a paramedical professions. Okay, it's a pharmacy profession, not a paramedical profession. Pharmacy practice is a unique and very different from medical practice, and it cannot show its presence under dominance of medical officers of health ministry. So that has to be taken into point. We can see health should have top priority on the agenda of any country. In developed countries, 6 to 14% of GDP is spent on healthcare, whereas in India, it is just in the range of 1.2 to 1.4% during last four years. Currently, Government of India has raised the spending to 2.5% of GDP, which is still insufficient. So, increase in healthcare spending should be increased more. The role of pharmacists must be clearly defined. The aim of national health policy is to take the health services to the doorsteps of the people. Pharmacy Council of India has no role in evaluating current knowledge of the pharmacist other than his educational qualifications at the time of registration. The continuous pharmacy education should have a legal status to implement uniform community pharmacy practice. They should bring certain continuous education programs which has to be made mandatory. Now we will see and we'll try to understand the Pharma Vision and the punching words given is Pharmacist for Healthy India. The four major areas as described in the document are sufficient to establish pharmacy as an integral part of healthcare team, which are as follows. Now we shall understand the four different regions which are sufficient to establish the pharmacy profession as an integral healthcare team. First, interact with other professions as the preferred source of information and advice on prescribing and management of disease state through appropriate therapy. So you should initiate appropriate therapy. Develop pharmaceutical expertise and facilities in order to deliver high-tech and individually tailored medicines in the primary care settings. So individually tailored medicines as per the need of the patient and it as per the patient individuality. It is patient-centered effort. Be actively involved in national health programs like promotion of essential drugs, control of HIV/AIDS, TB, communicable diseases, and prevention of tobacco use. So when you become actively involved in all national health programs, then you become part of the healthcare teams. Become knowledgeable to participate in medication management and outcome monitoring. It not only starts with selection, identification. You should become knowledgeable enough to participate in overall process of medication management and at last outcome of the therapy monitoring. Summary. What we have discussed so far, the pharmacy word is derived from Greek word pharmakon, which means drug or medicine. Pharmacy practice is an art of science and science of performing all the activities related to the patient care, which means related to the prevention, correction and avoidance of drug therapy related problems and prevention or treatment of illness, and utmost care is taken while dispensing of medications, dispensing of quality medicines as their prime function. Then we have seen the classification of pharmacy practice into different regions, mainly community, hospital, clinical and drug information pharmacy practice and clinical pharmacy practice and other types of pharmacy practice is further classified into different regions. Then we have seen the concept of 8 Star Pharmacist, which has been given by Federation of International Pharmaceutical Education Society. Then we have seen and we have tried to understood the role and responsibility of the community pharmacist. Then we have talked about the status of community pharmacy in India and what all the suggestive actions for improving the status of community pharmacy in India. That concludes the chapter about introduction of community pharmacy management. Thank you.